Yeah, so for people who haven't been to these communities, to Sioux Lookout, and don't fully understand the northern context, whether it's medical students, administrators, policymakers, other health professionals, what would you wish that they could understand about Sioux Lookout, the northern communities, and how they could support your role here?
I think I would first of all like them to understand the beauty of the people and the land in this part of the world, and that our indigenous people are of tremendous value, wisdom, knowledge, and deserve, to be appropriately cared for in the system of in every part of the system, whether it's health, education, that they get the appropriate respect. Our remote communities, of which we have 33 remote Indigenous communities that we service, have very little access, and so we fly to them. These communities have suffered for many years all the consequences of colonialism, residential schools, and now we're seeing the serious fallout. So these communities are incredibly challenged by many of the social determinants of health. So poverty, overcrowding, diseases that are virtually extinct elsewhere in Canada, and adding on to that, the opioid crisis is very serious issue, leading to breakdown in families, family relationships. People have very little in the way of parenting skills because of the residential schools. So I want people to know and understand the beauty of the people, and that their desire to get back to their traditional ways, their desire to improve the health and well-being of their communities, and they need huge amounts of support in many areas. I listened to Prime Minister Trudeau today when he was asked specifically about one of our communities in Estangaga as to why they haven't had a boil water advisory for 25 years, and he couldn't adequately answer the question. And the reporter then went on to say, but you were quick last week to send the army to Nova Scotia, where they were suffering the effects of Dorian. And yes, that would be more people, but it's probably more politically expedient for him to do that than to worry about some small remote Indigenous community. But the fabrics of these communities, their lives, is just constantly being eroded, devalued, and there's a long way to go to improve the well-being of our Indigenous people. And I want people in Canada to know about this and to realise the tremendous challenges. From a healthcare perspective, there's huge challenges in providing care to these communities because of the remoteness, because of the fact that patients are probably sicker than they are just about anywhere else in Canada, that we have no specialists in this area other than general surgeons, and we are really struggling to continue to provide the sort of level of care and to the communities that they need.